Well, so hello there, good afternoon, and welcome to The Pulse. We're coming to you live from our studios here in Accra. We are also live on your digital terrestrial TV because you can catch us on DSTV channel 421, GoTV channel 144. This is Joy News. We are fearless, independent, and credible. Coming up this afternoon on The Pulse, we need to tell you about this. 3 deaths in 2 days. Ghana Medical Association raises concerns over the resurgence of COVID-19 cases across the country as reports reveal that even some medical professionals are shying away from taking their jobs.
Put our act together as a people and take hold of our lives through the preventive protocols as well as the vaccination. Most likely we'll be in a better position by the time this current surge abates.
That's more on this shortly as we engage health authorities and break down the latest figures for you here on The Pulse. And also, nearly 3 years since the Attorney General commenced prosecution of Men's Gold CEO Nanapia Mensah, not a single witness has testified, with the case remaining at its initial stages.
I nearly killed myself that day. I nearly killed myself. Even the day I went to Men's Gold, I heard it on radio. I could say it's not true. So I myself went to their head office at Jolu.
Indeed, a sad development, and that's all on our latest Total Recall edition, as customers, including one who has lost his sight, continues to bear the brunt of not having access to their funds. And this afternoon as well, Inspector General of Police interdicts 4 more senior officers over the Kumasi Islamic Senior High School violence, which has left at least 35 persons injured. We have details about a fact-finding mission by the Defense and Interior Committee of Parliament in the area. I'm blessed. As another Pulse, as always, is brought to you by Global Communities Dignilu, affordable safe sanitation. Remember that this afternoon we're streaming live on all of our YouTube channels and also on social media. It's at JoyNews on TV. Feel free to join us with the hashtag The Pulse. My personal handle is at Blessed Sogah. Always a pleasure serving you here on The Pulse. Please stay. Well, this afternoon, the Ghana Medical Association is asking government to reintroduce some restrictions in the wake of the resurgence of COVID-19 cases across the country. Now, moments ago, the Health Service confirmed 3 COVID-19 related deaths, with experts raising concerns that the country may not be able to contain the 4th wave, with vaccine hesitancy still a challenge in battling the COVID-19 pandemic. The Ghana Medical Association and the Ghana Registered Nurses and Midwifery Council is also concerned that the resurgence of the cases does not give a good signal in the country's fight against the pandemic. Well, I've been speaking to Dr. Justice Youngson, who is Vice President of the Ghana Medical Association.
What you just stated as some level of hesitancy in the community or the country called Ghana with regards to vaccine uptake is real. Based on some of the preliminary works done so far, there are clear indications as to some of the reasons why the vaccine hesitancy is actually a problem for us. It could span from religious beliefs and reasons through the fear of the unknown, misinformation, disinformation, propaganda, and what have you. But for us, we don't want to limit ourselves to these only. We want to get to the crux of the matter, and that is why we want to embark on this project, especially the research component. And the right place to start from is, as we say, from hope. We are health workers, and we believe that health worker hesitancy is real. We don't want to just rely on the little information that we have gathered per some of the works we've done earlier, because we've seen that some people, for example, took the first dose, but they are reluctant to take the second, or may have taken the first 1 or 2 doses, but are reluctant to do the boosters. So clearly, even after the initial uptake, there may have been a change of mind, for which reason we need to get to the bottom and get all the reasons. So beyond the bits that I listed as some of the general things that we've all gathered, at the end of this project, most likely would unearth a lot more of the reasons why this hesitancy still persists amongst health workers.
But the initial figures is staggering, about 40% as you're pointing to.
Yes, because like you're saying, some may have taken the first dose, but haven't taken the second or the booster. What it means is that, yes, at the first dose level, maybe the hesitancy wasn't that much, but at the second dose level and probably even the booster level, we are seeing some sort of hesitancy. So clearly, if you put all of it together, even though it's not an absolute figure, it tells you the amount of work we all need to put in. And it's most important that we deal with it at this time because we are beginning to see surges in the number of cases that we have. And for us as health workers, we bear the brunt. I mean, if you take a small area like Kolebu, it's not a small area, but let's say a segment of the health sector. Kolebu, I'm sure recently we've all seen some of the statistics in terms of infected persons that came out through the public affairs unit of the hospital. That tells you that clearly we have some problems at hand. We are at risk because we are almost always the go-to persons when people are ill, for which reason we also stand the risk of getting infected in the process. So for us, we want to embark on this, make sure we get to the bottom of all the issues. It also helps us to put across the right kind of information to disabuse the minds of people who, for some reason, are getting hesitancy to go ahead in terms of what we all planned or we all hoped that the vaccines will do for us. Because if somebody has taken the first dose and is hesitant to take the second or the booster, clearly you need to identify the key reasons.
And it's indeed good that you're talking about the latest cases that we're hearing of. In fact, we are told that we have recorded our first two deaths after seeing the surge again. That also brings into mind the issue about the general public. What's the concern of the Ghana Medical Association and the message from your outfit to the general public on this?
Well, we have stated time and again that we all need to be very careful. And what that means is that, one, we need to stick to the preventive protocols. The wearing of masks, the use of sanitizers, soap, running water for hand washing, physical or social distancing. These are very key, especially where you find yourself in indoor places, work environments, cinemas, what have you. You need to protect yourself because once the surge starts, we almost always know that may be the beginnings of a wave. And with the wave comes all the problems like you're talking about. Before this current rise in numbers that we are seeing started, our levels were low, somewhere in the 40s, 20s, 30s. We didn't have people who were critically ill or severely ill. But suddenly we have them and we are beginning to see the consequences. So, truth be told, there's a likelihood that this could be a mirror image of some of the previous waves we have had. But based on the experiences that we have all been able to gather, if we put our act together as a people and take hold of our lives through the preventive protocols, as well as the vaccination, most likely we'll be in a better position by the time this current surge abates. Else, we all run the risk of perishing at some point.
Should we consider going back to some of the restrictive measures?
I think that these are very clear issues that we need to address. Yes, at some point, for economic activity and for our general lives to move on, when the numbers were such that as a state we thought they were okay or they were tolerable, we eased the restrictions. And that was happening in other countries because life has to go on. But just as it's been done elsewhere, the moment the cases begin to go up, you know that if you don't go back to the preventive protocols and adhere to them strictly, you run the risk of even collapsing your entire economy. For which reason, at this point, I will urge every single Ghanaian to go back to the protocols swiftly.
How about government? Because
yes, I'm coming to that. The state itself will also have to ensure that, look, we go to the old protocols that served us so well and prevent this current surge from getting to the levels that we had previously and from losing more lives. The fact that government relaxed the restrictions at some point does not mean that we cannot go back to same. And looking at the figures, it is time we begin to enforce the protocols at all levels. As they say, prevention is better than cure. We need to prevent ourselves from getting it, because our current economic situation will not even support huge numbers as we were able to do, let's say, somewhere in the year 2020. Because the expenditure on COVID, I don't have all the details, but it's huge.
Well, so time now to look at the figures and what it is that is happening across the country. Let's break that down for you in terms of the COVID-19 infections as we speak. For now, you can see that clearly we're dealing with some 1,311 active cases. If you look at the trajectory all the way from February of last year to where we are now, clearly there's an indication that the curve is beginning to rise again and rising up above the constant drop that we witnessed right from February to the early parts of March and then April that's this year. But then if you look at where we dropped from, somewhere around 1,876 cases, it appears that we are inching closer and closer to that gap again. So we're going back to where we started from. That's how the national picture is looking like. But we do know that the National COVID-19 Task Force is giving indications, which we'll get to very shortly. But in terms of the deaths as well, you see that the cases are going up again, just as we witnessed in March. So there you have it, 2 cases. But as of now, we're recording 3 new deaths as we're recording today. So that would definitely cumulatively add up to the cases that we have in terms of the national count. And then that is likely to further push the cases up. So the National COVID-19 Task Force is indicating that it is taking immediate measures and steps to scale up vaccinations across the country to deal with these cases. Well, Director of Health Promotion at the Ghana Health Service, Dr. Abuajida Costa, tells JoyNews that people must get back to adhering to these protocols.
Have delivered about 16 million of the doses into people's arms, as I narrated from our dashboard. Now, the perspective of the GMA and the Nurses Association are that the under 25 seems to be leading the hesitancy score. So the question is, what is the Ghana Health Service doing? Now, what we are doing is that we will be targeting the schools and the universities. In fact, we have a program that we call YOLO. You only live once. We work with youth organizations, youth associations. So we're going to scale up this intervention to make sure that the youth are on board in getting the vaccines in their arms. Now, again, the GMA and the Nurses Association will be converting about 2,000 of their nurses and doctors and other healthcare professionals into health champions to address the hesitancy within the healthcare profession. And this, they will do it in collaboration with the Health Promotion Division. In fact, that is the whole essence of being here. But to the larger extent, we want Ghanaians to take the vaccines. So I think it calls that there is more work to be done, and we call on the media, other partners to support us in addressing this hesitancy. We really want to reach our population immunity target of 22.9 million. And I think it is important that everyone do play their role. Our approach for fighting this pandemic has been all society approach. So we mobilize, we get everyone on board. And it is this reason that I'm calling on everyone to make sure that the chiefs, our religious leaders, our various stakeholders, to make sure that they help us in creating demand for the vaccines. It will serve the interest of Ghana. We don't want to return to the old days when we were doing lockdowns, we were obviously being restricted in so many ways.
Already the Ghana Medical Association is advocating for that, calling for the return to the days of some of these protocols and restrictions. What's your take on that?
Okay, so thank you. Let me say, you see, I think for us, the protocols have actually not been lifted. You see, but maybe we need to communicate more prudently, or we need to put it very well. The fact is, we say that it is not mandatory. Mandatory is not to say we shouldn't wear it. We are only saying that, obviously, for open spaces, you do not have to, but we also, our statement was emphatic on enclosed areas. And if you look at the current data coming up from workplaces, from enclosed offices, you could see that we were on point to suggest that if you are in enclosed areas, you have to put on your face mask. And it is the same thing that we are advocating. So the face mask is crucial in reducing the infections, especially in this time that the infections have started going up. So I think it's the case of continuous education to the public, to explain it well, to let them know that the face mask, the hand washing, all the others are very important, and it's not the case that they should abandon those. Because in fact, the GMA, JRNA put it that aside the benefit that we have derived from the protocols in terms of COVID, we had others, like we have had reduction in cholera cases and diarrhea cases. So it means that we need to see how, as a country, we can institutionalize these protocols going forward.
None of them tops the issue of the vaccination. In fact, we're recording our first 2 deaths from this resurgence of the cases. What official reports do you have on some of these critical cases and the first 2 deaths that we've recorded?
Okay, so thank you. I think I'll take it from what the data is saying, as you rightly put. Now, you know, we have a robust surveillance system that monitors some of them. That's why we are able to give continuous updates.
Well, fortunately, it's a good time now to have a conversation with the gentleman himself who's joining us via Zoom, Director of Health Promotion at the Ghana Health Service, Dr. Abuajida Costa. We'll be talking to him shortly, but I have a host of others as well joining us. Dr. Christian O, the National Lead for Severe and Critically Ill Patients, the National COVID-19 Case Management Team, and also Dr. Titus Bayo. He's the General Secretary of the Ghana Medical Association. Let me start off with you, Dr. Bayo. You are all doctors now, so I must be careful. But Dr. Bayo, start off with us. The concern is that even some of your medical professionals are not willing to take the vaccine. So it goes then to the heart and the core of the concern that you have, that some persons, particularly even your members, are not willing to take the vaccines. Why?
Thank you for the opportunity, and good afternoon to everyone. Indeed, this is a concern to us, and we did emphasize that it is healthcare workers in general. We have doctors who are vaccine hesitant, we have nurses who are vaccine hesitant, and some other cadre of healthcare workers. And the exact reasons, some are apparent to others, others are not. To us, others are not. For instance, we know there are people who, for religious reasons, for misinformation, disinformation, for conspiracy theories, have various belief systems about these vaccines, and we've been trying to encourage people to take it. In the coming days, we would be releasing in detail the impact of COVID on us in a year, for the first 1 year, as we are approaching another, what looked like an obvious surge in the cases again. And for a year, when you look at the impact on doctors, it will be foolhardy for any doctor to decide not to take this vaccine. But we are not focusing only on doctors. We are looking at all other cadre of healthcare workers. And I think it is a generality of the population. But we are particularly concerned about healthcare workers because we are seen as role models. and people look up to us in our communities here and there. And so if we are not taking the vaccines, then how do we encourage others to take it? And we are perhaps the most vulnerable of people who could easily get this infection, and hence the importance of this collaboration that we have started to educate the public, to educate our own members, to be champions in the communities to help improve our vaccine uptake. Believe me, it is one of our surest tools in overcoming this pandemic.
Yes, but if the doctors are not taking the vaccines, then it appears that truly there may be some problems with the vaccine itself. Are we correct in putting across that suggestion?
No, I don't think it's that there is a problem with the vaccine itself. The doctors come from a population and they have their own belief system. Whatever you believe in the community, there are doctors who may also have that kind of belief. But the science and evidence we have as of today prove that this vaccine is very safe, and we are encouraging everybody to take it. You will recall that at some point, a group of doctors came up with a petition against the vaccine, and the association made our point very, very clear on it. Other members who are well versed in vaccinology also made the science and facts well known. But like any society, you would have one or two people who would have this kind of belief system, or have some belief in the various conspiracies and not want to take it. But to date, we do not have any serious concern for which reason we would want to take that, to say that no one should take the vaccine. The FDA regularly publishes any vaccine adverse events that are reported. They have a task force that is reviewing all the data. Until date, if you check their website and information they are putting out, we do not have any cause to think that the vaccine is not safe.
Well, very shortly, we'll be pointing to some of the initial findings you're getting from the report that's yet to be released. But Dr. O, the point is, and I don't have any scientific basis to back this, but you find many people, connecting to the issue of COVID-19 cases just as much as we wear our nose masks. When the president addressed us and told us not to wear them anymore, or to do so out of volition, the belief was that, well, it's a free time for us. We're free. We don't have the virus anymore.
All right. Good afternoon, and thank you. And good afternoon to your audience and my colleagues on the panel. Okay, so let me first of all correct a misrepresentation, because as Dr. Abaji Costa mentioned earlier on, information, education, advocacy are extremely important aspects of this, and the media plays a very massive role in that. So you just said that the president asked us not to wear the mask anymore, even before you added, or on our own volition. And that is communication. I
guess not exactly the same way I'm putting it, but the essence is you may wear it or not.
No, so I think that is my responsibility as it is yours, to make sure that misrepresentation of information, especially when it has to do with life-threatening pandemics like this, are done appropriately. They say, and that is what I say, that bad news is news. Good news, most of the time, nobody wants to broadcast out there. And in the last 3-4 months, you will bear with me that nothing in the media has happened in way of advocacy, both with respect to vaccine and the preventive protocols. So we all have a responsibility. And let me be quite very, very clear on that. And I'm not absorbing anybody, including the media, and more so the media, because you are the fourth estate. You set agenda of what is discussed. In most cases, even what we as health workers go out to speak about, if it does not fall in your agenda, in most cases may not get the platform to. So that responsibility lies with everybody, more so with you. Just as you're asking us about our role as doctors and role models when it comes to advocacy. And that takes responsibility with my colleagues on that we are role models. We are not just medical doctors, nurses, pharmacists, biomedical scientists. With respect to treating sick people, we also have the responsibility in preventive care. preventive medicine. And that is why we're saying that although among health workers, we actually have the highest proportion of vaccinated people in our country, which is actually around 60% or more. The average vaccination in the country is nowhere near there in the general population, but we are saying that 60% is not enough. That, as you said, that it sends out the wrong message. If you have 40% of doctors, of nurses, of other health professionals who have not vaccinated, and I prefer to use data that are not just being subjective. So I remember very well similar discussions with the media during the fourth wave, where I presented what our data is showing with respect to those who are vaccinated and who are not vaccinated. So I'm going to reiterate that because we have that data, and I'm not quoting data from outside our country, but locally generated data from the Ghana Infectious Disease Center, that we showed that those who are vaccinated and those who are not vaccinated still stand the risk of getting infected. In actual fact, in our OPD, of over 1,000 patients that had come by the middle of December last year, that about 39% of them were among those who had vaccinated, whereas 61% were unvaccinated. And these people who were vaccinated were both whether single shot or fully vaccinated. At that point, we had not started booster. Now, that number still is similar as we speak now. Now, what is happening is this. When we looked at our ward, and we did present of those who are admitted with severe and critical disease, that 95% of them are among those who are not vaccinated. It was just 5% as against 39% of vaccinated people who found themselves in our admission with severe and critical disease. And the patients we had who died during that wave, all of them were vaccinated.
So your argument is that you are more susceptible if you do not vaccinate, or what's the point, Ben?
So the arguments have not really changed. And again, and that's why I want this to be very clear. Until a point that we have vaccinated enough to have a population that most people are vaccinated and have antibodies. And let's remember that the vaccines have their duration. So yes, we're getting people who fully vaccinated last year who have not had their booster. And from our information, just about 1% have had their booster who are getting infected again. And we have reviewed those people, and most of them who are way more than 6 months since their full vaccination are losing their antibodies. Now, what we're saying is this, that until that point where almost the whole population are vaccinated, and where it means that then they can prevent the spread, that every one of us still stand the risk of getting infected, whether you're vaccinated or not vaccinated. That is as simple as it is. But those who are vaccinated then has a better chance of not getting severe disease.
That's a critical point that you're raising there. And I guess it's now time to explore the strategies with Dr. Da Costa to find out exactly what the task force will be doing to encourage more and more people to get on board, to get vaccinated. Dr. Abaji, what exactly should we be expecting from your outfit in the coming days?
Okay, so thank you so much, and greetings to my colleagues online. There are a number of interventions that we'll be rolling out, and a number of partnerships that we'll be forming. One of which we are doing with the GMA and the Nurses Association, where we are starting from our own health workers to make sure that they obviously get the right information, they get the right things to obviously become role models to not only their patients but to themselves. So it is the reason why the GMA will be transforming about 2,000 health workers in districts with low vaccination figures. I think it's about 25% in those districts. Now, not only that, from the data that was also presented, it's suggested that the youths, those under 25, are hesitant to obviously take the vaccines. So our target will be in schools as well. In fact, I've seen some regions now linking up with the Ghana Education Service, scaling up vaccination in secondary schools. But I'll also add that for the health promotion, we have a program that we do. It's called You Only Live Once. And this is targeted at the university students and university students. So we'll also be using that program to complement what we are doing in the secondary schools. Now, as a country, we are using the National Immunization Days as a means to scaling up our vaccination exercise. We've realized that if we do 2 to 3 weeks active community engagement prior to the National Immunization Days, it will help uptake of the vaccines during those campaigns.
Right.
So that is what we will be doing. And I think that, we are linking up with churches, traditional authorities, and the media. So it's a case of also, as Dr. Owu said, the others also playing their part. Like, what is the role of the traditional leaders in this vaccination exercise? What is the role of our church leaders in this vaccination exercise? What is the role of the media in our vaccination exercise? So once we are able to do all this, I'll put all these interventions together, you will see that it will come together for us to reach, obviously, our target of the 22.9 million eligible people that
right. I'll come to the Ghana Medical Association, Dr. Titus Bayo, shortly for us to assess the strategy that you're putting out. But there's one outstanding issue even about the vaccination process, which has got to do with your database or the cards that you're issuing out. It appears that the first batch of persons who received the jabs are not too sure of the procedure. Some don't have the vaccination cards. We understand that there's no database on them. And so taking the boosters is becoming a challenge. How are you addressing some of these concerns as well?
Myself or
Dr. Da Costa, yes.
Okay, so, and the question is, sorry?
Yes, I was asking about the vaccination cards, those who took the vaccination, the first batch. The belief is that some of them are not captured in the database, so they're having difficulties taking the booster shots, and they are not too sure of how to go about the procedure in itself. What education do you have on that? Or do you have the database on such
This
persons?
comes to me as a surprise because I think we have some backlog which we have cleared. Now, if you have been vaccinated, we do this from the various centers. So all they have to do is to go to their various centers and their details will, because it's online, all they have to do is...
The problem is about tracking it. In fact, as we speak, there's an example in studio here talking about how they got the early vaccinations, but then they're not too sure if their details will be captured. Is that possible to find out? Just by walking to the center and mentioning my name, for instance, would that pop up?
Yes.
How do you go about it?
Yes, your name and date of birth is what they need in obviously retrieving your information. So I don't think there should be any problem on that. But if, for example, people are struggling, then I think what they will have to do is to link up with the COVID-19 helpline, which that's the one at the Government Information Center. That's a 321 and also I think 112. They will link them up to us and we will be able to help them. Because I know for sure that we have addressed some of those issues, but if there are people who are still in that category, then we will be able to help them.
Okay, so what you're doing now is that your platforms are available to such persons. Is that what you're doing?
Yes.
Okay, let's assess the issue of the 29 million target, and I'll start off with you, Dr. Titus Bayo, on that. You've heard the plans laid out by the national COVID team task force, pointing out clearly what it is they intend to do to reach that target. For the Ghana Medical Association, are there some more factors that we need to be on the lookout for in achieving that target?
So I think we need all partners on board. That is critical. We know that the attitude of people to these vaccines is much influenced by the knowledge that they have and what is being discussed in the media. If people are informed that we are in another wave or there's an imminent threat to their life, then they are willing to take the vaccines. If people think that the disease is gone, there's no point, then they are not going to queue up and take these jabs. From the point of the Medical Association, we are targeting districts where we have very low vaccine uptake rates, and we are going to go in there, again, relying on the media to partner us so we can use your platforms in local languages to try and educate and inform the people about these vaccines. We are going to go to churches, we are going to go to mosques, we are going to go to any gathering, the sports stadia where people gather, barbering shops where you can get the men. We want to use all these avenues to reach out to people and let them know that, look, it's not only about you, it's about our collective protection and survival as a nation. Do we really want to have the days of a lockdown again? I don't think so. Do we want to see news items about how people are being buried and they are struggling to get places and relatives are not given permission to access their bodies? I don't think so. So we want people to see the risk that this poses to all of us and the fact that their individual action can affect the entire community. And we are hopeful that, especially in these targeted areas, if the uptake goes up, it will help all of us. As you would know, a lot of people trust their doctors and their healthcare workers when they give them information. They will trust the media when they give them information. Typically, they will not like information and they will doubt information coming from politicians and things like that on this issue. I have on one platform trying to educate people, and I was surprised that someone said, oh, COVID money is getting finished, and that is why they've started increasing the figures so that we'll say COVID is bad. and this is a belief that's so that politicians are deliberately increasing, but we are the hospital. Healthcare workers, we are seeing the reality. We are seeing our colleagues, we are seeing people coming with non-specific symptoms. You ask them to do a test and the COVID test comes positive. So if we go out there with this message, we believe that the people will believe us, they'll trust us, and they'll key up and take up these vaccines. But our greatest partner is the media. This is our collective survival, and I think we must view it as such.
Just by the way, though, Dr. Da Costa, is the money finished, or you still have some left? Anyway, but let's touch on the reports that the Ghana Medical Association is yet to release. Just briefly, some of the indications that are striking in that report. We know it's not fully ready yet, but some indications that you're picking up. So we can all have a bite on that.
We reviewed our data in 1 year, and we're looking at 1 year of COVID from March 2020 when it first hit to March 2021, what the impact was on medical doctors. And we lost 9 doctors in the process. We had over 544 doctors infected. We look at doctors by grade and by place of work to see if you are a junior doctor, are you more exposed? If you're a senior doctor, are you more likely to die? Who is more exposed than who? What is your risk based on where you work? If you are working at an emergency or at the outpatient department or in the theaters and anesthetist, what is your risk? This is the kind of data that we looked at. And it will be published soon and we'll make it available. We hope that it will drive this vaccine campaign so that we all know that in this second or whatever, I think we have lost a bit of time as a country. The period where we're recording 0 cases was our best time to get everybody vaccinated. But typical of the Ghanaian, when there is no imminent threat to their life, we'll take things lightly and wait till we have seen that there is a serious threat. And now that, like my colleague Dr. Wu said, even then, nobody was discussing it. From the media to everybody, nobody was discussing COVID. So if you go tell somebody, take a vaccine, they're like, for what? Already we didn't want to take this vaccine. And now we are convinced that the disease is gone. Why should we take the vaccine? Maybe if it comes again, we will take it. Right. Now that we all know that the threat is real and we are seeing the dashboard and it's not pleasant, it is our hope that ordinary citizens will queue up and take these vaccines to protect all of us.
Let's bring in Dr. O then. I'm just interested in finding out what kind of or categories of persons you mostly deal with in terms of the critically ill patients. Has it got to do much more with age, or depends on the variant that the person has been infected with?
So thank you once again, and that is the problem we're having and probably going to continue to have, because the age keep dropping. During the very first 2 waves, we were acting even before vaccine came. The majority of people who were ending up in severe and critical centers were those who were elderly with multiple comorbidities. That has significantly changed. In the last 2 to 3 weeks in the Ghana Infectious Disease Center, we are steadily admitting patients who are severely ill with COVID-19. I've already admitted 2 today, and then another 2 yesterday. And for your information, I just finished reviewing just before this a 9-month-old baby who was seen in one of the municipal hospitals, who had diarrhea, fever, treated for malaria, discharged home, and then come back 4 days later with not getting better. So the parents were cancelled, and then they had a COVID test done, and this 9-month-old baby is positive. The question is, are you? We were looking at saying that the kids were not getting infected. And remember that our age of vaccination still has not gotten to those children. And they are getting COVID. The university students are getting COVID. Those who I'm admitting here in the last 3 weeks, we've had a 14-year-old. We have multiples in their 20s and then multiples in their 30s. The funny thing, or the ironic thing, is that a good chunk of the elderly people with comorbid condition did vaccinate, and they are being spared. I discharged an 87-year-old woman just last week who from our ICU, who has multiple medical conditions, has vaccinated, and actually was preparing to get her booster, was not feeling too fine, and decided to test. And she was positive. She came in with severe disease, and she was discharged in 5 days. She walked out of our center. Whereas I have 2 patients, and I'm in the center as we speak now, who are in their 50s, unvaccinated, and they are on their 17th day on admission, still on oxygen. And we are hopeful that they will go home, but they did not need to be in hospital for 3 weeks if they had vaccinated. So yes, the age is dropping. Those who have comorbid conditions or chronic medical conditions are still at higher risk, but it is not just that.
So it's just it's mostly, I guess it's mostly about the vaccine. That's what's more paramount. Once you have it, you reduce the risk, I guess.
It is. Let me say something else, which is very clear. One of the things we said when the vaccine came on board was that vaccine is one of our protective or preventive protocols. So we keep mentioning preventive protocols and talking about hand washing, distancing, and then wearing our masks. It is time that in that same breath, we mention getting vaccinated and getting your booster when you are due to get your booster. And that is important aspects of this prevention, because if we get vaccinated significantly, we stand a better chance of beating this infection coming in waves. If we do not, I am not being a devil's advocate, but I can tell you clearly, because the science does not lie. We'll be back to discussing this again
anyway,
in 4 months' time.
And that's what we definitely want to prevent, Dr. O. Let's wrap up with you, Dr. Da Costa, your word to the general public and what to expect from your outfit in the coming days.
Okay, so thank you so much. I think from just this conversation from Dr. Bayo and Dr. O, clearly you can see that the unvaccinated population poses a risk not to themselves, but the whole country or everyone. So it is the reason why everyone must be vaccinated. You see, as for the Ghana Health Service, what we're going to do is those that I obviously told you. We're going to scale up the campaign on the vaccines to make sure that we get the vaccines on people's arms. And we're going to do this with partnerships with organizations like GMA, youth groups, and the media and others. We need the support of the general population, especially those who are not vaccinated, to go and get their vaccine. The vaccines are available at all government facilities. We have enough quantities in stock. So please and please again, Ghanaians, we are pleading with you for our collective good. Let us all go and get our jabs. We want you to have the first, second, and booster doses to protect us all. Thank you.
Thank you so much. That's Dr. Da Costa, Dr. Bayo, thank you, and Dr. O as well. We're grateful that you have all spent some time with us here on The Pulse. Well, nearly 3 years ago, the Attorney General commenced the prosecution of Men's Gold CEO Nana Pia Mensah. He is accused of defrauding thousands of customers of millions of cedis through his gold dealership firm, Men's Gold. Not even a single witness has testified in the case, and there's been more than 20 court adjournments. In today's edition of Total Recall, we tell you the story of how some customers who are bearing the brunt of Men's Gold crisis, one of them got injured while protesting in demand of his 100,000 cedis investment. His injury has rendered him visually impaired as he remains in dire need of money. Joseph Akable tells that story.
I nearly killed myself that day. I nearly killed myself. Even the day I went to Men's Gold, I heard it on radio, but I could say it's not true. So I myself went to their head office at Jolu. So as somebody told me the thing, that, hey, now one thing I just fell down, and then some of my friends put water on me before I get up. I nearly hung myself. I did it cry because my wife and the children came to saw me that I was dead, tight and rope to kill myself, because that is my life. That is everything to me. I don't have anything. My family, there is nothing. So I'm the one that I struggle to help the family.
39-year-old Stephen Abuaje is now suicidal. His suffering is the result of bad investment. He put all of his eggs in the Men's Gold basket in the hopes of making a fortune, but everything went wrong. His life went from optimism to frustration to current despair. In this edition of Total Recall, I engaged 3 persons including Stephen, whose lives have been forever altered by a desire to invest in a gold dealership. Men's Gold was an investment that was too good to be true. Investors were assured of 7 to 10% monthly returns of investments. So people invested with their life saving and even secured loans and invested in a Men's Gold business. Investors were ready and willing to defend their investment company, but they later changed into protesters desperate for their money. In July 2019, state prosecutors filed charges including defrauding by false pretenses against CEO of the defunct company, Nana Pia Mensah, aka Nam1. This was after he had returned from the United Arab Emirates, where he had been in custody for months.
To assist us make full recovery of the amount owed Men's Gold by Horizon Royal Diamond in Dubai. As an act of good faith, we are willing to engage the Attorney General's office on the best possible way for them to aid Men's Gold by employing international law and diplomatic relations to ensure we achieve this objective. 2. To unfreeze our companies and my personal bank account and assets for us to utilize these as vehicles to get productive in order to meet our liabilities, owed to our customers and some business associates in our bid to resolve our liabilities immediately.
Nearly 3 years on, monies invested by the thousands remain outstanding. His prosecution has not even reached the level of a single witness testifying. The case has seen more than 15 adjournments with prosecutors constantly asking for more. Stephen Abuaji's hope keeps deteriorating. He's one person whose life will never be the same.
A friend told me about it, that this what has come to the system, that thing is very fine, so I should put myself into it to help me. Even the car that is using at the workplace is the same men's good money, so I should try my best and do like 6 months and see what will happen. And then I go to my bank. I invested at Commercial and then Access Bank, so I went there to withdraw all my money there, and then I drew to go and buy the good chips to men's good.
I mean, were you not worried about whether this is a company that you could trust, whether it is registered? Were you not worried about all those issues?
I'm somebody that I used to do more investigations, but what touches my heart that I put my money is the time that the guy was helping GFA, and then he was conniving with the president. You know, I see everything was genuinely. That's the motive purpose that I invested in men's good.
You mean when you saw photographs of him doing stuff with the GFA, the presidency?
The presidency, I see everything was genuine. So that is the reason I invested in it.
Well, part of the report there by my colleague Akable indicating clearly that a lot of people are definitely suffering as a result of the prolonged prosecution, and also some more attempts by government also to retrieve the funds. But men's good customers obviously are calling on government to do something about this. Joining us right now via phone is Fred Forson, member of the aggrieved men's good customers. He's also convener of the group. Fred, welcome to the program. First of all, have you lost hope yet, or you still have some little left in you that you'd be able to retrieve the funds? Fred Forson, I hope you can hear me.
Yes, give me just 1 minute.
Yes, but Fred, Fred, can you hear me? I'm just trying to find out from you. Hello, Fred. Fred, I'm just trying to find out from you if you have completely lost hope, or perhaps you still have a little left in you that you'd be able to retrieve your funds.
Yes, blessed, come again.
Yes, I'm just asking if you have completely lost hope that, you'll be able to get your funds, or you still have a little left in you that, yes, if, some more efforts are put in place, you'd be able to get the funds.
No, I don't know if I get it correctly, that whether we'll be able to get our funds.
Yes, whether you have hope that you'd be able to get the funds, yes.
Yes, we do have that hope. But when this whole thing happened in 2018, a certain narrative was put down the state of Ghanaians, even though it was porous, and people bought into it and said government attitude towards the men's good victims is the type that I describe as I don't care. They went into a wrong investment and all that. But when you look at the law, when you look at our practice, and even government-owned policies, you realize that it appears to be a deliberate thing, and there appears to be an unholy intercourse between the government and number one. And so whatever they are doing is just to deprive the customers of their money. Maybe taking you a little back, you remember when this happened, the finance minister told us that they were going to sell the assets and use the money together with what they have in his account to pay the customers. The Honorable Kennedy Japan also came up and said there were some $20 million in an account. Now, one himself, when he came back from Dubai, told that requested the government to unfreeze his account so that he can pay. So when you put all these pieces together, you come to understand that there is a deliberate attempt to deny the main good customers of this locked-up investment. But I think it's important for us to understand the area the government come to the reality that it is responsible and solely responsible for the payment of the men's good customers, the better. Because let me tell you, the government fell into the trap on 12 September 2018 when, through its agency, the Security and Exchange Commission went to the premises of Men's Gold or whatever, issued a letter to collapse the company, and there in 2019 January went to the court to take over the assets of the company. As we speak, January this year, government has also gone to court for an order which was granted for them to sell the assets of Men's Gold. So even if it takes 1,000 years, the government of the Republic of Ghana is responsible for the payment of the customers. But what is paining us is the fact that many customers are dying, many lives are being deteriorated, and government seems to be, I don't care, and they are doing whatever they like. But it should be noted that even if it lasts for 100 million years, it's the government of the Republic of Ghana which is indebted to the customers. And we only know one person who is supposed to pay us, no other person than the government of Ghana. Because as we speak, those who even went to court for a judgment, when they obtain the judgment, they are not able to execute the judgment because the assets and the bank accounts of the company are in custody of the government. That is the narrative.
So what do you see as the way forward?
The way forward is that it is better and to be more prudent for this government to come clean, to be faster. They are wasting time, they are delaying time, and people are dying. They should rush and pay the customers. Because whatever is happening, we lay it at the doorstep of the government. Government should take over the asset. In fact, what the Attorney General, the criminal prosecution that is happening in court, which is at its very slow pace, we know it's just a charade. We know this government doesn't, but this government cannot prosecute number one, simply because it doesn't have the capacity. I don't want to go into the law, but if I have my way, I would say that it doesn't even have what it takes to prosecute. What they must do to save life is that they should come back and use civil procedure. Let me tell you something. In 2016, when the DKM issue happened, government went to parliament.
Apologies there. It appears we've lost Fred Folson. We'll definitely get back to that conversation a bit later. You're still watching The Pulse on the Joy News channel. Now, the Inspector General of Police has actually interdicted 4 more police officers for their roles in last week's disturbances at Abrapo Islamic Senior High School near Kumasi. Now, this actually brings to 7 the number of police officers interdicted so far in connection with the incident. At least 35 students and some tutors were injured. JoyNews sources say the names of the interdicted officers are being withheld for their own safety after being caught on camera making some derogatory remarks about the students. Well, let's speak to correspondent Ohiming Teria, who's been following this for us. Ohiming, first of all, you've been checking with your sources at the police administration. What is, some of the details, and do we even know the identity of the officers now? Do we have a clear idea of those who are making the claims and what ranks perhaps they fall within? I mean, if you can hear me, I'm asking whether or not we have any more details, from your checks with the Ghana Police Service on this.
Yes, Sogah, I do have some details as far as the interdicted officers are concerned. The Director General of Operations was in Kumasi when he met the Muslim leaders, and he, revealed that 4 of the officers who were working at the control room of the Ghana Police Service in the Ashanti region are those found to have misconducted themselves, and that is why the Inspector General of Police has taken steps to interdict them. The 4 officers, one is a chief inspector, an inspector, and 2 corporals. So there's a policewoman and 3 other policemen who have been interdicted in that regard. I must say it's been difficult getting details from the police administration. They are tight-lipped, especially when it comes to the identity of the police officers involved. But yes, still, we managed to see this information to also present to our audience. So yes, 4 of them were in the Kumasi or the Ashanti Regional Police Command's control room. They are the ones who have been interdicted.
All right. How about this? We are also told, as we know, that the Defense and Interior Committee of Parliament is also ready with some reports after a fact-finding mission. What more are we learning about that interaction?
Yes, through my interaction with the members of the Defense, Interior and National Security Committee, after their meeting or their visit to Kumasi on Friday, the 18-member committee was first at Islamic Senior High School, where they interacted with school authorities and the students and the teacher, for instance, and the other teachers who were also assaulted in the June 13 incident. Prior to that, they had met the Inspector General of Police at the police headquarters. That was on Thursday, where the IGP briefed them about the fact that 8 police men were also, injured in the process.
Right.
So after meeting the school authorities, they proceeded to speak to the police officers, the men who were actually detailed to maintain law and order, and some of them were also injured in the process. But few minutes after that particular meeting, a chairman of the committee, Kennedy Ohene Ejapon, minks no words, and he said the police officers ought not to have fired tear gas and also live shots, especially on the school campus. And he also faulted officials of the Urban Rules Department for not acting on the letters, several letters written by school authorities of Islamic Senior High School, which dated back as far back as 2012, with several reminders in 2021.
Right.
So he said the committee, though it was yet to come out with this report, it will recommend that sanctions or head must rule at the Urban Rules Department, as well as sanctions that are taken against the police officers who went ahead to shoot or fire live ammunition and also tear gas during the protest, even at the time that some of the students had left to their various dormitories and classrooms. And so the indication I get is that the committee will want to commend some sanctions for the Urban Rules Department, not only at the regional level, but at the national level as well. And also the police service also take some, flaps for misconducting itself at the time that it was sent there to maintain law and order. And so these are the key points that I got from the committee's report, which is likely to feature in the committee's report.
So calm has returned to campus?
Sure. For now, the students, as at Friday, were busy with the academic work, and the Form 1s were also actively taking part in their end of semester exams. So CAM has returned to the Islamic Senior High School, and it's a normal day for both teachers and students of the school.
Amen. Thank you. Now, the Greater Accra Regional Security Council, as we understand, has served some notice to all persons illegally occupying lands belonging to the Animal Research Institute to evacuate within the next 48 hours. What's accounting for all of this? We'll tell you right after this break. Please stay. You're welcome back. Now, the Greater Accra Regional Security Council has served notice to all persons illegally occupying lands belonging to the Animal Research Institute to evacuate within 48 hours. Now, for years, unscrupulous persons have sold 800 acres of these lands. Now, the remaining 200 have also started witnessing some encroachments recently. Now, according to the Regional Minister, Henry Korte, the activities of these encroachers have compromised millions worth of vital research work. He warns that the council, in a three-phased approach, will begin demolishing all buildings within the encroached lands. We can take a listen to the Regional Minister.
The Animal Research Institute has been in existence since January 1957 and has been responsible for the development of cutting-edge research to aid animal production in Ghana. Located in the Adentan municipality, their lands span over 1,000 acres. Over the last 10 years, about 800 acres have been encroached. 2 weeks ago, the Regional Security Council visited the site and promised to retrieve the lands.
It is sad and that people have the effrontery to move onto government property and build anyhow. A typical example is this one. It's supposed to be a people are fencing, raising a fence wall around it. I wonder where we are getting to. So we have come to look at it. RegSec will go back and meet and will take a decision, but in no time we'll inform you. But I foresee a situation that by the grace of God, and I say again, by the grace of God, we'll go through the process and all this will come down.
In pursuant to that promise, the chair of the Regional Security Council, Henry Korte, has issued a 48-hour ultimatum to house owners in the area and land guards to evacuate immediately or they will be forcefully removed.
Armed land guards, we are told, walk in and out of the institute with impunity, some riding motorbikes and compromising the biosecurity of the farm animals. We wish to place on record that none of the buildings have any building permits. Consequently, RegSec is collaborating with the Adentan Municipal Assembly and the CSIR to remove all unauthorized structures mushrooming within the fenced land without further delay. RegSec is hereby giving a 48 hours notice from now, effective now as we speak, to all those who are putting up such unauthorized structures within the fence wall to pack their tools and materials from the land without fail. Any persons found loitering within the 200-acre perimeter after the deadline will be dealt with in accordance with the laws of the land. RegSec with the Adentan Municipal Assembly and the Animal Research Institute proceed to remove every structure on the land subsequently.
Meanwhile, Henry Korte says investigations have begun to help unravel the identities of persons involved in the illegal sale of these lands.
Yes, we have heard rumors that some people, it's been alleged, working within the CSIR may be part of the whole scene. We will get the security intelligence agencies to begin investigations into that, and then once they get results, they will bring report to us and we'll forward it to the appropriate quarters for the necessary actions to be taken.
But MD of the Institute, Dr. Ebenezer Ansa, says previous attempts to ward off the encroachers ended in violence.
Your head of security, so many occasions. Other staff, on so many occasions, our staff had to do a sit-down strike. They lay down their tools, they say they can't work. The
Security Council says it will fight to restore the lands to the Research Institute. For JoyNews, Michael Ashale.
Well, the countdown is still on, but fortunately we've been joined in studio now by Dr. Ebenezer Ansa, Director of the Animal Research Institute, Council for Scientific and Industrial Research. Thank you so much, Doc, for your time. So it appears that even the situation there is fast deteriorating. There are even attacks on some of your members, as you are pointing out to. How did we get here in the first place?
Thank you very much, and good is it evening or afternoon to your audience. That's a difficult question to answer, but let me say that we didn't invite the encroachers. They came on their own, and initially they started doing it under the cover of darkness. And because we don't have adequate security staff, by daybreak you find a structure, standing, which previously or the day before was not there. So this has been a cat and mouse game. We bring in the police, they run away, the police leave, they come back. So this has been the situation over years.
Do we know the history surrounding how you acquired the land as CSIR? Because perhaps these landowners, and I'm using that word advisedly, may have been ordering a sale, a resale, or whatever arrangement it is that's allowing people to go in there with some level of entitlement to put up structures. What's your take on that?
Let me say categorically on TV that no one, per the laws of this land, has the right to go in and put up unauthorized structures on the land. This land was acquired by government in 1976 through Executive Instrument 38. And the law clearly states that when government has the right to compulsorily acquire land, whether they have paid compensation or not, you have no right to go in there. You go in there, that is against the law. That is what the Lands Act 2020 at 1036 says. If you refer to section 236, unlawful occupation or sale of public lands, it is very clear. So, and the sad thing is that the owners were compensated.
At the time?
Yes. So no one has the right to go in there. It is criminal. The loss of this land.
If you take a look at where the walls are being raised, just as we've seen in the report, is that portion yours, or perhaps because it's too close to your area, that's why you're asking these persons to stop the development?
You see, where we have raised the wall was done just for the purpose of practicality. Far beyond the wall, all that land belongs to Animal Research Institute. And because it's been a cat and mouse game, we decided that, okay, let's fence it off. We don't have the resources. We had to acquire a loan, which we haven't even finished paying. And interest are accumulating on that loan.
Just to fence the area?
Just to fence the 200 remaining portion. These land guys broke the fences, made of blocks. And I'm talking about just a couple of months ago. It became unbelievable. I don't know who was motivating them. Broke down all these walls and came here and were building as if they were being funded by the World Bank.
But then, in terms of your activities as CSIR, how would the construction of, say, a 3-bedroom house or a story building affect necessarily the research that you have to carry out in that area? For someone who doesn't understand what it is like, what your work entails, how would the construction of these facilities affect your research work?
Thank you very much for that very important question. Now, there is a reason why the land that was given by government to Animal Research Institute was that vast. All over the world, I'm sure your listeners have traveled to some countries, advanced countries, developing countries. You realize that animals and human beings and plants coexist even in cities. And to be able to develop your livestock industry, you need a large tract of land for grazing. I just returned from Amsterdam just a couple of days ago. From the air, just around even Schiphol Airport, you see a vast land of greenery, and they are just pasture. For some areas, you will see some of the pastures harvested and baled to be taken up to various farms. And this is just around the airport in the middle of Amsterdam. It is not only peculiar to Amsterdam. You go to London, Heathrow, the same. I mean, it's all over. For even a developed and advanced countries in Europe. And I can assure you land is much more expensive out there than here in Accra. Now, coming back to the question that you asked, when the CSR was set up, its mandate included all ranges of animals. We're talking about pigs, we're talking about poultry, that is broilers, layers, guinea fowl. We're talking about ruminants such as sheep, goats, and cattle. When it comes to cattle, they require a very large tract of land to be able to graze. And like I mentioned earlier, we need to harvest. So precisely that is the reason why such large tracts of land.
And you keep all these animals?
Yes, we do.
Okay.
Now, let me come back to the next part of your question. When you are carrying out an experiment, you see, the purpose for which this institute was set up was not to support subsistence farming. To be able to feed the country, we need to go into commercial large-scale agriculture as a nation. And the reason why government assembled all these arrays of PhD holders was to develop expertise that will put us in that category. Now, when you develop a technology, you may do it on a small-scale experimental basis. You need to scale it up on a pilot basis. Then finally, for it to become relevant to commercial-scale agriculture, you need to try it on farm. So we need to have farms that has the same size and capacity as commercial farms.
Okay, so
and if it
helps basically your simulation exercises.
Precisely
if I
the
could
point.
use it that way.
Precisely the point. Absolutely. So for us to be able to advise a commercial scale farmer and tell him that your technology works, we need to be able to demonstrate that on a commercial scale.
And yet all the 800 acres is gone. So how do you do it now? How do you make up for the loss?
Honestly, I don't know where we go from here. It's a difficult question to ask. Because that is where we find ourselves.
Okay, so let's explore the issue of the solutions here. Will a relocation be the best way out of this? Because some would argue that if we're dealing with some 100 acres and 800 is taking out, you have just about 200 or 300 left. I don't know the exact figures of now. Then the best solution is to find another completely new 100 acres for you to allow that proper and standard operations that you may be seeking for.
So the question
how about that approach?
The question is, if we relocate Animal Research Institute to a different place, are we going to encroach on that again? And then we will relocate Animal Research again?
Good question.
That is not the way to go. As I mentioned earlier on, all over the world, take Oxford University, take Wageningen, I'm an alumnus of Wageningen University. You see universities, industries growing together with farmlands inside the city. So that is the ecological and sustainable way to go, because we depend on each other. It is a food web. We are interconnected.
For how long have you been fighting these land guards?
For years, dating back as far as the 1970s. But in recent times, it took an alarming turn, where these land guards became so I don't know what word to use. The level of impunity is undescribable. I mean, it's mind-boggling.
And what's interesting is that you're a state agency. The belief is, at least you would have called the Ghana Police Service, you may have gotten in touch with the security agencies just to flash out these persons, and yet you're not getting the solution to it. How come?
Well, as I mentioned earlier on, we don't have a permanent police presence in terms of a police station on our land. So what we do is we call in the police patrol from Adentam Divisional Police Command or the District Police Command, because the Frafraha police station, I mean, the personnel is not able to handle such a, a request. Now, when they come in with their police patrol, the langars run away. The moment they leave, they return. And sometimes they even work in the night, as I mentioned earlier on. And that has been a cat and mouse game that we've been fighting, over years. And we don't have the capacity to stop the langars as an institute.
Right.
We definitely have to rely on the police.
But the good news is here, the Regional Security Council is giving 48 hours. What's your expectation? I guess the ultimatum expires today or tomorrow?
Well, the ultimatum started this morning when the press conference was held.
So we're
by
expecting
the
that
Honorable Minister.
by tomorrow, by the end of tomorrow?
Tomorrow will be 24 hours. The next
it started yesterday, right? Or
no, it started this morning.
That was done this morning.
Yes.
Okay, so
tomorrow will be 24 hours.
24, and then we have a.
So the 48
will do another 48. Yes.
Yes, that's right.
So we're expecting. What's your expectation as CSIR?
My expectation is that the encroachers will begin to move their structures, some of which are kiosks and other, structures. Blocks that has been put there will be removed, and then they themselves will evacuate. If they chose not to do that, I think that the Regional Security Council should, come in and remove all those unauthorized structures, because that is what the law says. Anyway,
we'll be waiting for that exercise. But Doc, thank you so much for your time here on the Pulse World. A tomato truck has emptied its content in the median of the Tesano Alajo stretch early this dawn. Now, the truck, which was traveling from Doma Ahinkro in the Bono region to the national capital Accra, is said to have failed its brake and run into a traffic light. My colleague Manuel Kranting was there and our report.
So it's currently a desperate effort to salvage what can be saved from this rubble of a Kia Rhino truck, which overturned right here on the stretch leading to the Kwame Nkrumah interchange. For now, two lanes, one towards Kwame Nkrumah interchange and the other towards Tesano, have been taken by the truck with tomatoes splattered all across the streets. For now, it's a rush for what can be saved. As you're seeing, the young men now trying to cut what they're able to collect from this rubble into another truck, which we're told will be heading towards the depot of the owner somewhere at the Agboglushi market. For now, though, we don't know how much is estimated to have been lost from this particular accident. But we're told that the truck contains 60 boxes of tomatoes. Currently, we have police presence here attempting to direct the traffic and make sure that it doesn't compound the situation all the way towards Achimota. In just the past couple of minutes that we've been here, I've noticed that the traffic light at this particular intersection doesn't seem to be functioning properly. It is past 7:25 by my time, and the traffic light is still blinking on amber. That gives an indication of the sort of confusion, at least at this particular intersection. Until the entire, remainder of the tomatoes in this truck are collected, we perhaps would see the continuity of this traffic, which is building up and is only, flowing by the help of men from the police MTTD, who are under the instructions to help ease the flow of traffic until the truck has been towed away from here. Well, I've been speaking to the driver of the truck, who has been giving some details on when they moved and how they got here.
The friend Collins here, boy.
Collins here, boy. Una now drive a car. Okay, incident is here.
This year, me feel break. Break na me feel here no. Na cars 4 and need money. Cars 4 need money no. Me dwe nipa na omotimu no enkwa first. Nti e ba sa no. Me hwe me driver sa na kwan kakra eda ho a metima dai afa ho. Te ba sa me de twi ne pavement wo kwan fifo. Me twi pavement na sanke be ya car ne be slow down. Enso me hwe se da car ne se kwan na ntimi slow down. And I'm casting me the book and Mususwa, ɛsɛ me dwene nipa na ɔmo tim car ne plastic car phone mu nkwa the ba sɛ me de twi pavement no me de twi pavement no emli kana stena de ekwa na ekɔ te twa sɛ me dan car na yɛdɛ ɛto fam na me dan car na ɛto hɔ
na mo yɛ nipa sɛn na mo tim
me pa kyene nipa 3
wo ne hwan
pa kyɔ me ne me mate ni ɛna ntosi ne ba no
okay na ntosi mo different fa
pa kyɛ different do man nkuro
time be na mo tu ye
me pa kyɛ you to do man nkuro around be 8:30 ne tu hɔ
na ɛnyɛ sɛ na mo ahyehyɛ tomatoes no ɛwɔ box no mu
sɛ de hu no saa na box no tata so wɔ kaa ne mu no saa na ɛhyɛ no do man nkuro na yɛde ba
mo ba no police engineer mo say bia na mo ahyehyɛ amana bro so emu aye dudodo
me pa che there be.
This truck is said to have been containing 60 boxes of tomatoes. Each of them, were told, sells on the market around 700 Ghana cedis to 800 Ghana cedis. And so if you do the multiplication, we are somewhere in the regions of tens of thousands of Ghana cedis that has been lost right here.
I never woke up when they called me. I could not expect this because the car left from the bush very early. You know, this car is supposed to be here higher, it's 4 o'clock. But accidentally, it's a traveler, you know. I don't know what happened. But accidentally called me around, that was 6 to 7, that the car got accident. I was so shocked, you know. It's electronics, anything can happen. We thank God. It's only the goose, but no one died. You understand me? That one glory be to God. Yeah, we are trying to sort it out from good one and bad one and know how much we can gain because it's a lot of money.
I see. Because we're told that it was 60 boxes.
Yeah, 60 boxes. Now in the market, one is 700 cedis times 60. Now we get only 10, and for that is 14 out of 60.
Well, sad one there. Now, what can drivers involved in road crashes be suffering from, and how did that lead to their deaths? Well, a study by the Kwame Nkrumah University of Science and Technology has found cardiovascular diseases such as hypertension to be the major conditions amongst drivers who died through road crashes. Well, Live FM's Kwesi Debra now looks at some of these conditions and reports.
I have
gotten to know that eating late won't be beneficial to my health. It doesn't help.
Unlike 60-year-old Matthew Atta, Kadr Isaka hasn't been successful controlling his nightly cravings, a lifestyle which seemed to have upped his blood pressure.
I get home around 10 p.m, so I end up eating late. Some time ago, I wasn't feeling well, so I went to the hospital where I was told I have blood pressure. I have been advised to stop eating late, but I can't.
Commercial drivers, like any other driver, are exposed equally to risk factors associated with the driving occupation. These factors can lead to poor health conditions that have a bearing on their performance on the road. In Ghana, research has found 23% and 53% hypertension and pre-hypertension prevalence among taxi drivers. Again, other reports have found about 39% and 90% prevalence of unrecognized hypertension and obesity. High blood pressure can cause heart attack, stroke, heart failure, blurred vision, and temporary loss of vision. Dr. Kwesi Ahmed is an eye surgeon at the Kofanochi Teaching Hospital.
For hypertension, you can have someone who he says, "Oh, me, my BP is high. It's always high." You think you are fine, but what is happening is that there's gradual damage to the cells and the vessels that are in the eye. The vessels that carry blood become stiff. Okay, so eventually it can progress, and then and it's worse in younger people. You know, where they come with hypertensive retinopathy, stage 4 hypertensive retinopathy, and then they can't see. and it is irreversible. Sometimes you're okay, you have a sudden rise in your BP, especially now that most people are stressed, most people are not eating well, you know, your BP suddenly goes up, and then all of a sudden the vessels in your eye just rupture, okay? And when they rupture, you bleed in the eye, vein occlusion, and then you suddenly lose your vision.
These conditions have largely been attributed to poor lifestyle choices. Benjamin Mensah of Stay Alive Health Campaign has been observing these poor lifestyles among drivers.
Drivers do not pay attention to their health. Drivers do not even have time to rest. Drivers don't have time to eat. They may say that they eat good food, but at what time do you eat the good food?
In collaboration with the National Road Safety Commission, he has been screening drivers in Ghana's second largest city of Kumasi and another city, Obuasi.
In all, we screen about 680 drivers or people, 495 being commercial drivers. Yeah, in the case of hypertension, we realized that 2 out of 5 drivers were hypertensive. And then again, 1 out of 10 drivers were pre-hypertensive.
What can drivers involved in road crashes be suffering from? A study by the Kwame Nkrumah University of Science and Technology might provide some answers. The findings, published in the Sage Journal Clinical Pathology, has found cardiovascular diseases to be the major conditions among drivers who died through road crashes. The study, which examined 127 driver deaths from 2009 to 2014, found that 44.08% of the cases were due to cardiovascular diseases. Dr. Jose Puku Sampini is lead scientist.
When the drivers were identified, the autopsies that were conducted were such that we took samples, certain samples, like the brain, maybe the eye, samples from the eye, the heart, the kidney, the liver, and so many other organs that were vital as far as the functions of the body is concerned. So we did that. And so when that was done, what happened was that realized that a lot of them, in fact, a lot of them had what we call systemic diseases, such as cardiovascular diseases, hypertension, cerebral. In fact, for instance, if somebody also is cardiovascular, you are looking at dilated cardiomyopathy, you are looking at so many mitral valve stenosis, you are looking at congestive heart diseases, you are looking at myocardial infarction, especially. The person is hypertensive, probably he's on his drug, he's probably on drugs, but he's not taking it. Or some of them are also not on drugs at all. They don't even know that they are hypertensive, yet driving. Do you understand? So when they get episode like stroke while driving, the person cannot be in a position to remove the leg from the pedal, because it depends on where the lesion is. If the lesion is on the right side, so the left side, these are the right side of the limb, which actually controls speeding, is going to step on the accelerator whilst he is not able to remove it from there.
What can be done then to assuage the situation? Dr. Sampini recommends a second look at license issuance.
Those who are going to issue license to prospective drivers, not only would they just go and ask you to, if you are able to read whatever they try to let us read. Sometimes you have to go deeper. There are people who have glaucoma. There are people who cannot see very well. There are people whose necks, probably they have some form of neck problems where they cannot turn the neck the way it's supposed to be turned for them to be looking around while driving. Do you understand? And those who are hypertensive, I'm not saying that if you're hypertensive you cannot drive. If you are hypertensive, make sure that you take the drug as instructed.
Dr. Sampini and Mr. Benjamin believe the hospital must be moved to the drivers.
You can set up mini clinics in the various lorry stations and then the various rest stops, so that every car that moves any long distance, when they get to rest stops, the driver subjects himself to these people. I'm talking about the nurses, and then they check their BPs for them. When they are leaving the station, their BPs are checked, and then records are kept so that if there's anything that we are seeing that somebody is hypertensive or somebody is likely to be hypertensive, the person is alerted and then checked, probably given medication. By so doing, we are looking for employment for those people, the nurses who are probably staying at home doing virtually nothing.
We must move the clinic to the drivers. This year, this is what we are trying to do. We decided that we'll go to 5 regions to start the campaign. We started in the Ashanti region. We are moving to Eastern region this June to continue with the screening. We will screen them on eye, dental, ENT, hypertension, what you call BP. We do normal body examination, blood sugar for them. We don't take money from the drivers. We don't take money from the drivers. We do it for free for the drivers.
In an era where diseases like hypertension and diabetes keep on rising, it's become crucial for an initiative like Benjamin's be encouraged so that precious lives are always protected. Reporting for JoyNews, Kwesi Deborah.
Well, a combination of tomato paste and cola drink have a significant increase in blood levels, indicating an anti-anemic potential. This was concluded in a study conducted by scientists at the Department of Biochemistry and Biotechnology of the Kominkuma University of Science and Technology. The scientists sought to investigate the alternative means of increasing blood levels in anemic patients to the known orthodox use of blood tonics. The combination is said to have improved menstrual flow of reproductive women. Emmanuel Bright-Kweku now reports.
My name is Josephine Felicity Apenyo Adam. I was once anemic.
The primary school teacher was diagnosed with a low blood level after undergoing a surgical operation.
I was diagnosed of some disease in my tummy, so I went under operation. So after the operation, I started feeling dizzy and bleeding. So after taking my blood, and my blood dropped to 4.7, and in fact, it was alarming.
As a royal, she's not permitted to receive blood from any person but someone of her kind.
I'm a royal, and our family, we don't take blood from outside unless maybe your brother or sister, yeah. And that time it was crucial. I look so pale, but it's okay.
Anemia is a medical term for low red blood cell levels. As an urgent public health crisis, the medical condition affects women, pregnant mothers, and mostly children. WHO estimates over 40% of children under 5 years are anemic. Nutritional deficiencies such as insufficient iron supply and infectious diseases including malaria are some of its common causes.
Remember the time you felt so dizzy because you had a lower blood level, or perhaps your friend or relative of yours suffering from anemia? What was the quickest traditional or orthodox medicine that came in mind?
I mixed turkey berries and hot water and gave it to my daughter who had just given birth. When she told me she was dizzy, she said, I gave my pregnant daughter a mixture of milk and turkey berries. Her blood level became normal, she said. But have you heard of the cola drink tomato paste mix for treating anemia? The mixture prepared from scoops of tomato paste diluted in some milliliters of cola beverage has been saving several lives in Ghana, including that of Josephine.
When you mix it, it looks like blood. So I think maybe that when you take it, the system also feels there's blood. I don't know whether it's psychological or something.
Interestingly, a research published in the Scientech journal is confirming the use of this traditional remedy. The study, conducted by researchers at the Department of Biochemistry and Biotechnology KNUST, revealed a significant increase in red blood cell volume. Professor Phyllis Mills Robertson is the lead scientist.
There are so many. If you take that Coca-Cola, that I'm just talking about that, those that are that have relationship with hemoglobin, vitamin C you can find in both tomato paste, and then that of iron is also in tomato paste, and then ascorbic acid. Okay, so all these have been found, especially iron and vitamin C combination. It has been found that in the presence of vitamin C, iron is absorbed better in the system. So it could be that vitamin C in the Coca-Cola and vitamin C in the tomato paste, as well as the ascorbic acid and then the iron in the tomato, helped in doing that, because it builds rapidly. So we don't know if it is reabsorption of the, or the red blood cells is produced by the bone marrow. It could be that it has some effect on the production.
With 500 million women of reproductive age being affected by anemia, the mixture comes in handy.
There's one student at Achimota School, for instance, who anytime she has the menses, has some like fainting and those, so she takes it and now she's very fine. So we hope to now transfer to human beings and see, especially with pregnant women.
As the scientists seek to extend the study to expectant mothers, the concoction could potentially reduce the over 45% anemic pregnant women in Ghana. For JoyNews, Emmanuel Bright Kweku reporting.
Well, and that's how we wrap up here on the Pulse on the JoyNews channel. My name is Blessed Sogah. Don't forget to log on to myjoyonline.com, where I have updates on all of the stories there. IGP obviously featuring there on the site for you. You can check it out for yourself, but that's all we have for you for now.